Hello, my name is Victoria Palacio Carr, and I'm with the Legal Action Center's No Health Equals No Justice initiative. Our initiative's mission is to uplift and advance community-driven solutions that address systemic racism and promote health of the mind and body. We envision a world where individuals and communities have what they need to be healthy and thriving. Community is at the center of our work. Our initiative is informed by our state and local partners, including folks who are direct service providers, individuals with lived experience, and advocates that work at the intersection of healthcare access and criminal legal system reform. Currently, there are threats to the healthy world that we strive for. So we are reaching out to you, our community, to outline how we can work together to combat these threats. I will now pass it over to my colleague Gab to tell you more.
Thanks so much, Victoria, and thanks for joining us all today. It's a really difficult time. We know that there are huge numbers of threats out there to all kinds of groups of people, including Black and Brown people, trans people, immigrants, people who work at the federal level in the federal workforce. It's a time of huge uncertainty and a lot of funding cuts that are being discussed, which would really be devastating to communities around the country. Today, we want to talk to you about one of those threats that's really urgent, where we really need your help and your voice. So Medicaid is really under attack right now. We know that Congress, under Republican leadership in both the House and the Senate, are working to try to pay for the 2017 tax cuts that really benefit billionaires. They benefit very, very wealthy people. They're due to expire, and to pay for an extension of those tax cuts, Congress has identified a number of different programs for huge cuts, including Medicaid, which under certain proposals that are out there right now would be cut by trillions of dollars, which would make it harder for people to have health coverage, harder for people to have access to all the kinds of health services that we need for our physical health conditions, mental health conditions, substance use disorders, all kinds of needs that we have. Medicaid helps tens of millions of people around the country, including kids and families and communities. And so we wanted to, again, kind of talk to you about this and let you know that something can be done. We know that your voices are extremely important. Debbie's going to talk a little bit about the impact of these cuts, what this would do to people we care about and our communities.
These proposed cuts to the Medicaid program would cause states to take drastic actions to make up for less federal money being available for their state Medicaid programs by having less people being eligible for health care coverage and services that they need, reductions in the availability of covered services, exclusions of certain people from being eligible for services, and less access to both substance use and mental health treatment and services. Because of these proposed cuts, what are some of the end results? It'll be harder to manage the health of people who have one or more chronic health conditions due to restrictions in eligibility and the availability of services. People in our communities will have poorer health outcomes that will include additional deaths by overdose and suicide because of reduced access to substance use and mental health treatment. So let's turn to my colleague, Roberta, otherwise known as Tony Myers, who will explain what we can do about these threats.
Thanks, Debbie. We also really care about and have a concern for people returning to community from incarceration. There is a huge need to ensure they have access to Medicaid services, to ensure that they get the medications and other healthcare needs that may not have been received while incarcerated. But again, we have an opportunity to fight back, and we need you to fight back. Reach out to your members of Congress today. We need you to do it today to tell them to protect Medicaid. Tell your story. It's critically important that elected officials understand that Medicaid is a lifeline for millions of people. If Medicaid has helped you access needed healthcare services, medications, or other supports, please join our effort to tell your story. We have information on our website. Again, the website is www.lac.org. You can get a form there to submit your story, or you can make an appointment to meet with your representative in their local office, attend a town hall if one is happening in your community, or any other public event where you can tell your story and let people know that they need to fight to protect Medicaid for our communities. We need you to do this today. We really need your help. Thank you.